start the recording. All right, let's go. All right. So every day we come in contact with potentially poisonous things. Acute poisoning affects 2 million people each year. Chronic poisoning is more common. Deaths caused by poisoning are fairly rare. Poisoning in children has decreased steadily since 1960s due to child-resistant caps. Deaths caused by chronic poisoning in adults have been rising as a result of drug abuse. Now, toxicology is a study of toxic or poisonous substances. A poison is any substance whose chemical action can damage body structures or impair the function of these body structures. A toxin is a poisonous substance produced by bacteria, animals, or plants. And substance abuse is a misuse of any substance to produce a desired effect. Overdose is a toxic dose of a drug. So all of these terms are important terms for you to be familiar with. All right? Identifying the patient and the poison. Your primary responsibility to the patient is to recognize that a poisoning has occurred. Pay attention to your surroundings, or you could also become exposed to the same substance, right? So pay close attention to the surroundings. Look for patients that are having similar signs and symptoms. Very small amounts of some poisons can cause considerable damage and it can lead to death. If you suspect exposure to a toxic substance, notify medical control and begin emergency treatment. All right. Signs and symptoms of poisoning vary according to the type of specific agent, right? Now, you can't remember all of that. It's definitely too much information to remember. So what you really have to focus on is what we would call toxidromes, the category that it falls in. The toxidromes is really what you need to pay attention to. Presence of injuries at the patient's mouth suggests ingestion of poisoning or poisons. So this chart here is very important. Let's see if I can zoom in on it. Right. So this chart is a very important one. So this table 21-1, you need to learn it, right? So write that down on a page or a card and make sure you learn that. Learn all of the information on this table. So this is what would be what we call toxidromes, the category. So you have opiates or opioids, you have sympathomimetics, you have sedative, hypnotics, you have anticholinergics and cholinergics, right? And each of these toxidromes will produce specific signs and symptoms. And pay attention to the signs and symptoms that are specific to each. Right? So this is what you really need to learn. And the other thing that you need to do when you're covering this chapter, group them. So group them in a way where you have agents that will depress the CNS system. So you need to have a category for agents that depress the CNS system, agents that will overstimulate the CNS system, and hallucinogens, right? Take that approach. All right. Now, if possible, ask the patient, what substance did you take? When did you take it or become exposed to it? How much did you take? Did you have anything to eat or drink before or after you took it? Has anyone given you an antidote or any substance orally since you ingested it? How much do you weigh? Right? Try to determine the nature of the poison. Look around the immediate area for clues. Place any suspicious material in a plastic bag and take it with you. Containers at the scene can provide critical information. If the patient vomits and there are pill fragments, you may have to examine the vomit to see how many pill fragments are in the vomit. Wear proper personal protective equipment. Note and document anything unusual that you see. All right, so let's look at how poisons enter the body. And it's the same way as allergens. The same way allergens enters the body is the same way poisons will enter the body. Now, emergency care for a patient may range from reassuring an anxious parent to performing CPR. Most often, you will not be administering an antidote, right? So rarely you will do that as an EMT. Definitive treatment can only be provided at the ED, so transport promptly. The most important treatment you can perform is diluting or physically removing the poisonous agent. All right, so as I said before, the same way in which allergens enter the body or can enter the body is the same way poisons will enter. So how you provide treatment depends on how the poison got into the patient's body in the first place. And we have 4 routes: inhalation, absorption, ingestion, injection. All 4 routes of poisoning can lead to serious and possibly life-threatening conditions. If you are uncertain how to treat a patient, find the container if possible and contact medical control or the poison control center. No, I'm not sure if there's a poison control center in Jamaica. Right? I am not sure. Yes, Miss Nesbitt.
There is a DIS, Drug Information System, that operates out of UTEC. They have a poison thing that is there, sir.
Okay. What's the number for that?
I am not sure. Normally, we'd probably have to call the UTEC switchboard, but I'm not sure. But it's called the Drug Information System, which is short
Mhm.
DIS.
Okay, that's good. That is good. All right, inhale poisons. Move the patient into fresh air immediately. The patient may require supplemental oxygen. If you suspect the presence of a toxic gas, you definitely need to request hazmat response. Use self-contained breathing apparatus to protect yourself from poisonous fumes. I don't expect you as an EMT to do that. I would expect a fire EMT to put on a self-contained breathing apparatus because you won't find that on the ambulance. You'll find that on a fire truck. And you should not be wearing it if you don't know how to use it. Some patients may need decontamination by the hazmat team after removal from the toxic environment. All patients who inhaled poison require immediate transport. Be prepared to use supplemental oxygen. Make sure a suctioning unit is available and working properly. All right. Inhaled poisons. Some patients use inhaled poisons to commit suicide in a vehicle. Exhaust fumes contain high levels of carbon monoxide. Chemicals or detergent in tightly sealed vehicles create a type of gas chamber. When you open the door, you may become overwhelmed by the gas or the fumes. Contact hazmat responders and have them removed the victim. It's not your role to remove that victim at that point. All right, absorbed and surface contact poisons can affect the patient in many ways. So skin can be affected, mucous membrane or eye damage, chemical burns, rashes or lesions, systemic effects. It is important to distinguish between contact burns and contact absorption. So the signs and symptoms that you need to consider: history of exposure, liquid or powder on the patient's skin, burns, itching, irritation, redness of the skin, typical odors of the substances. Emergency treatment: avoid contaminating yourself or others. Remove the substance from the patient as rapidly as possible. Remove all contaminated clothing, flush and wash the skin. And if it's a dry powder, you brush that off and you flood the area with water for 15 to 20 minutes, right? Then wash the skin with soap and water. If it's liquid, then it's the same 15 to 20 minutes, acid or alkali. Flood the area with water. When irrigating the eyes, just ensure that you don't cause cross-contamination. So if chemical agent is introduced to the eyes, irrigate them quickly and thoroughly. All right, now many chemical burns occur in an industrial setting. And usually when you go on an industrial site, if it's a large industrial site, you'll have areas set up where persons can shower to remove, or showers to remove chemicals of the patient are present. So safety showers and specific protocols for handling surface burns may be available. Hazmat team should be available to assist you. Ensure that you, your team, and the patient are thoroughly decontaminated. After decontamination, promptly transport to the ED for definitive care and obtain the MSDS sheet, material safety data sheet, which usually has information on the type of chemical, right? Now, ingested poisons. About 80% of poisoning is by mouth. These include liquids, household cleaners, contaminated food, plants, drugs. Ingested poisons usually accidental in children, but deliberate in adults. Signs and symptoms vary with the type of poison, the age of the patient, and the time that has passed since ingestion. Signs and symptoms will include burns around the mouth, gastrointestinal pain, vomiting, cardiac dysrhythmias, and seizures. Treat signs and symptoms and notify the poison center and medical control of the patient's condition. Consider whether there is unabsorbed poison remaining in the gastrointestinal tract, and whether you can safely or effectively prevent its absorption. So you may be required, based on your protocol, to administer activated charcoal. It's usually given when we suspect tablet overdose, right? But you will be guided by your protocol. So some EMS systems allow EMTs to administer activated charcoal. Always immediately assess ABCs of every patient who has been poisoned. Injected poisons. Now, exposure by injection includes intravenous drug abuse, envenomation by insects, arachnids, and reptiles. Usually absorb quickly into the body or cause intense local tissue destruction. Cannot be diluted or removed from the body in the field. Injected poisons, signs and symptoms that we need to be looking out for: weakness, dizziness, fever, chills, unresponsiveness, excitability. Monitor the airway, provide high flow oxygen, and be alert for nausea and vomiting. Remove rings, watches, and bracelets from areas around the injection site if swelling is occurring, right? And at this point, we will pause. So we're going to start back at 5 p.m. No, not 5 p.m. 5 minutes past 5. We will resume and finish this chapter. So the next phase of the chapter is going to go into patient assessment. 5:05.